Are you taking aspirin or thinking of taking aspirin? And perhaps you're wondering, how long does this thing last in my body? For example, you might have a procedure coming up and you want to know whether to stop or not. So let's talk about how long a single dose of aspirin is going to last in your body. So remember, aspirin has a number of effects in your body, and each of those are going to last a different amount of time. So the pain relieving and the fever reducing effects of aspirin, the analgesic and the antipyretic effects, pain relieving and fever reducing, typically last about 5 hours for a single dose. However, if you're concerned about having a procedure like a surgical procedure, you may be wondering, how long is the antiplatelet effect of aspirin, meaning the effect of aspirin that changes blood clotting. Specifically, aspirin deactivates and irreversibly binds to your platelets, and your platelets are responsible for causing blood clotting. And because your platelets are deactivated and therefore people don't clot blood as easily and they're less likely to have heart attacks and strokes. However, if you're having a procedure and you're on aspirin, this may not be a good thing because then you may bleed too much and you may have difficulty and dangers from that procedure because of the aspirin. Aspirin deactivates a platelet for the entire lifetime of that platelet, which is approximately 7 to 10 days. Even though aspirin itself has a half-life of only about 20 minutes, meaning half of the aspirin is digested or metabolized in your body in only 20 minutes, it still has an effect on these platelets in your body for up to 10 days. So talk to your doctor about whether you should stop that aspirin depending on how severe the procedure is. And what you should do in case of a procedure really depends on your other risk factors, your other medical conditions, and the severity of the procedure and how much there is a chance of you losing blood in the procedure. So those are all variables you want to talk to with your doctor. For a minor procedure like dental work or a skin biopsy, most doctors will not tell you to stop aspirin, but for a very intensive procedure like a major surgery, and especially if you're taking more than a baby aspirin, your doctor will probably ask you to stop that, especially if you don't have very severe heart disease. Because if you do have very severe heart disease and you stop that aspirin, the risks of developing a blood clot or having a stroke or a heart attack because you stop that aspirin may outweigh the benefit from stopping the aspirin in not having so much bleeding during a procedure. So a very simple question, a very simple decision you think you're trying to make is not so simple. So think about all those variables and talk with your doctor. So in conclusion, for fever and pain reducing, aspirin is going to have an effect in your body for only about 5 hours. But for its anti-clotting effects, aspirin is going to hang out there and have that effect by deactivating platelets for up to 10 days. So thanks very much. If you enjoyed this, check out this other video here and join my free newsletter anytime. Thanks so much. Take care.